I'm Eric Skindred with the Hospital Association of Southern California. Today we're visiting with Cathy Chidester, Director of Los Angeles County's EMS agency. LA County EMS is the largest multi-jurisdictional EMS system in the country. Cathy has been at the agency's helm since 2006, but her experience in the emergency medical services area runs deeper. She started work in the field as a pediatric charge nurse and as a trauma nurse coordinator at PIH Health Hospital Whittier. She also served at several other facilities. Cathy then discovered a passion for teaching and instruction and worked training EMTs and paramedics before starting her career with the county. First of all, welcome Cathy Chidester. Thanks so much for being here today.
Thanks, Eric. I'm happy to be here.
Now, in the text portion of the interview, you related how much hospitals and their partners had learned during the early pandemic that helped them successfully cope with last winter's surge. If we have another surge, and no one knows for sure what's going to happen, do you think professionals will be even better prepared? Or what should they do now to be better prepared?
I'm certain that the hospitals and our EMS providers will be better prepared. I don't possibly see, you never know, because the November surge, really took us by surprise as far as all the complicating factors it introduced. I don't see another surge having quite the complicated factors that this last surge had. And by that, I mean staff call-offs. A lot of the hospital staff became sick with COVID or were exposed to COVID, so they had to be quarantined or self-quarantined. So there was many issues with staff. If we have another surge because of the vaccine, I don't foresee that being such an issue. And then other issues like the oxygen sources and several different oxygen problems that occurred, they've been resolved by the hospitals, so I don't see those being issues. I think if there's another surge, number one, we're better prepared. Number two, because of the vaccine and other exposures, I don't think we'll see the number of issues that we saw over the November, December, January period.
Thanks for those insights, Cathy. That kind of segues into my next question, which is, during the past year, we know that many people, including nurses and doctors, made the decision to withdraw from emergency medicine due to the pandemic's intense pressure. What makes the difference in this area? Is it innate personality, or what are the successful coping strategies shown to improve responses for everyone?
I think some of it's coping strategy and resilience and what the individual is actually seeing. My hat goes off to, and I totally respect the emergency department, ICU staff, the nurses, physicians, anybody even works in the area, any support staff, because those are really very intense, even under normal circumstances. They're intense situations. So I can see after that surge, people maybe changing their career paths and having other thoughts. And so the basic resilience, and then the other thing is having the support from your peers. I certainly here at our office, my administrative staff and the staff that were working through the pandemic, we all talked about what we were going through, and we certainly supported each other. And I didn't see, the things that the hospital staff were seeing. And like I said, I just might have the greatest respect, and my hats go off to them for what they endured. But what we were doing here, just the fact that we felt we were supporting the hospitals and the emergency staff, and secondarily with that, the patients, and doing our part to fight COVID and try to save, some lives or aspects of making the job easier for the staff at the hospitals. Those were things that kept us going here at the EMS agency.
Thanks for those very helpful ideas, Cathy. Now, finally, looking at the pandemic as a historic event, is it something you ever thought you would see in your career? I imagine during your teaching days you had pretty significant discussions about scenarios that might occur. And so I just kind of want to get your view of the pandemic and what it represents as a historic event for the region.
They always talked about pandemics and getting prepared for pandemics, and that just seemed like so far off to us. And then we have the Department Operations Center here, and we've been preparing with the hospitals with the hospital preparedness program. And I thought maybe we would see an earthquake and have our operations center up for a week, maybe 2 weeks. And working with our disaster staff, I had no idea that we would end up in such a pandemic like this and have our Department Operations Center supporting the hospitals and EMS staff for a year. It's just incredible. I never thought in my wildest dreams that we'd see anything like this.
Thank you so much for being with us today, Cathy Chidester.
Okay, thank you so much for your time.